Good day. I'm Syra Jaredi Dumali from BSN 1B of Holy Trinity University, Group 14 for RLE. And for today's return demonstration video, I'm gonna be serving and removing a bed fan. So with further ado, let's begin.
Come in.
Good morning, sir.
Morning.
I'm Syra and I will be your aide for today. Sir, can I have your aunt, please? Can you state your name for me, sir?
Earl Kirby,
How about your age?
24.
Okay, sir. Okay, sir Earl. So for today, I'm gonna be serving and removing your bed fan. Would that be okay with you, sir?
Okay.
Okay. So after explaining the procedure to the client, I'm gonna perform hand hygiene, assuming that I have already performed medical hand washing. And after performing hand hygiene, I'm gonna wear my gloves. So now I'm wearing my gloves. And now I'm gonna prepare all the materials that I will be needing for the procedure. So assuming that this is a bed fan, I'm gonna warm it by rinsing it with warm water. Okay. And now I'm gonna adjust the bed to the appropriate height. So I'm just gonna adjust your bed to the appropriate height, okay? Okay, sir. And after that, I'm gonna elevate the side rails on the opposite side of the bed. So I'm just gonna raise the side rails, okay? And after that, I'm just gonna untop the lower part of the bed and expose the client. And now, sir, I'm just gonna flex your knees, okay? Now, sir, you can rest your weight comfortably on your back heels. Okay? So, and after that, I'm gonna help the client as needed by placing my one hand under the client's lower back and my elbows resting on the mattress and using my other hand as a lever. Okay. So, sir, can you put your hand in your chest? Okay. So, sir, I'm just gonna use my hand on your lower back, okay? Sir, yeah. So, just gonna, okay? And now on the other side. And after placing the waterproof barrier on the client's buttocks, I'm gonna lubricate the back of the bed fan with a small amount of a liquid soap. So, sir, I'm just gonna put this bed fan on your buttocks, okay? So, sir, you can now rest your feet and cover the exposed area. If the client is dependent, place him on his side, placing the bed fan against his buttocks and then rolling him onto the bed. Okay. So again, I'm just gonna untap this lower part of the bed. Okay. So, sir, can you flex your knees for me? Okay. Just gonna remove this bed fan. Okay, sir. Lift it a little. Okay, now, sir, lay your feet. So, sir, I need you to lay on your other side. Okay. Sir, please. Oh, yes, sir. On the count of 1, 2, 3. Okay. Now I'm just gonna place the bed fan against the client's buttocks. Now, sir, roll over, sir. Okay. Now, after that, I'm gonna cover the client with the top sheet. And after that, put the bed into a semi-Fowler's position if permitted by the patient. So, sir, are you comfortable with your position?
Yes, I'm comfortable.
So, do you still want me to put you into a semi-Fowler's position or not na po?
No.
Okay. And after that, I'm gonna cover the patient with a bed liner. So, as you can see, the patient is already covered with the bed liner. Now, I'm gonna provide the toilet tissue and place the call light under the client's reach. And of course, I'm gonna put the bed to the low position and raise both side rails. So, sir, I'm just gonna provide you with this toilet tissue paper. Okay, sir. So, sir, I'm placing the toilet paper tissue here. In my hand. And, sir, I'm just gonna put this call light beside you so that you can call me whenever you are done. Okay, sir? And of course, raise both side rails. And put the bed to the low position. So after that, I'm gonna leave the client for about a minute and answer the call bell whenever he calls me. So, sir, I'm gonna be back for a minute, okay? Okay, sir. So, always remember to do not leave anyone on the bed fan longer than 15 minutes unless they are able to remove the bed fan by themselves. So, now, when removing the bed fan, return the bed to the position used when leaving the bed fan. Okay, sir? So, sir, I'm just gonna adjust your bed to its original position, okay? So, sir, I'm just gonna untap the sheet. Dispose your area. Okay. So, when removing the bed fan, hold the bed fan steady and cover it and place it on the chair. So I'm just gonna get the garbage bag. Sir. So, sir, I'm just gonna flat your knees, okay? Sir. So, sir, lift your feet, sir, okay? Lift your butt, sir. Okay? Always remember to keep the bed fan steady. And then put it in the garbage bag. Then put this on the adjacent chair. Okay, sir, can you move to the other side of the bed, okay?
Low oversight. Yes, sir.
So, if the patient needs assistance, wear gloves, and now I am already wearing my gloves. And after that, prepare layers of toilet paper tissue and wipe the client's buttocks from front to back. So I'm just gonna get this toilet paper tissue. Okay, yes, sir. Wipe it until it's clean and dispose. And dispose again. And of course, if the patient is dependent, wash the perineal area with soap and warm water and thoroughly dry the perineal area. So I'm just gonna get the equipment that I'll be needing. Assuming that this is a warm water, a hand soap, and assuming that this is a clean cloth. Warm water, clean cloth, dispose, then salt, okay. Then clean cloth again. Then warm water. Okay. And then remove the waterproof barrier. Okay. So now, sir, you can now lay flat on your back. Okay. So I'm just gonna cover you again. And now, for all patients, offer a warm water, a washcloth, a towel, and a liquid soap, and then wash the client's hands. Okay, sir, so now I'm just gonna wash your hands. Okay, sir. Sir. Assuming that this is a clean cloth. Sir, your other arm, sir. Okay. Always remember to wipe and clean the hands individually. And dispose. And then dry it thoroughly using a towel. Okay, sir. Grab your hands, sir. Okay. And after that, assist the patient to a comfortable position, and then empty and clean the bed fan, and then return it to the bedside table. So now I'm gonna empty and clean this bed fan. Okay. Now empty the bed fan and dispose the garbage bag Now clean the bedpan and place it on the bedside table. And after that, remove the gloves and discard it, and then wash your hands, then perform hand hygiene. Okay. So, after removing my gloves and washing my hands, I am now performing hand hygiene and then spray the room with air freshener. And after that, I must now document the odor, the color, the amount, and the consistency of the urine in the feces and the condition of the perineal area. Now we are done with the procedure. Thank you.